Good day everyone, I am Yna Denolan, a BSN 1B student, and for today I will be doing ear assessment. But prior to this performance, all of the materials needed should be complete and organized, and I have to wash my hands before and after this assessment. Here are the materials needed for this ear assessment. Here we have our gloves. We have our pen light, which is also our makeshift otoscope with our magnifying glass. We have our tuning fork. We have our watch. And we have our alcohol for further disinfection of our hands. So now, I will disinfect my hands and I will don my gloves and start the ear assessment. So after donning my gloves, we will start with the ear assessment. But first, we will provide privacy to the patient and we will introduce ourselves in this process so that we will have the consent of the patient. So good morning, sir. I am Yna Denolan, your nurse for today. May I know your name, sir?
Jubin Jan Piparao,
So good morning, Sir Jubin. What's your age?
11 years old.
11 years old, thank you. So for today, I will be doing ear assessment. In this case, we will know if you have any hearing impairments, lesions, nodules in your ear, and by the tug test and palpation, which I will be touching your ear, we can also know if there are any tenderness or masses in your ear. And in this, we will also have to run some tests. And we will be starting with whisper voice test, in which I will be whispering some words or syllables or numbers, and you will repeat it once I cover your tragus or this part here. And then we will do the ticking watch test. I will be placing the watch just about 5 inches and you will state to me if you can hear it. And then we will do the Weber's test with our tuning fork. I will place it just right in front of your forehead here, and we will test the lateralization, in which you can hear in one ear or both ears sa sound. And then we will also do the Rene or the Rins test, and we will also be using the tuning fork, and we will also test the air and bone conduction here. So I will place it here, and you will also state if you can hear it. So we will perform it in both sides. And we will have to do lastly the Romberg test, in which we will test if you have your balance. So in this manner, sir, we will be testing your hearing acuity. So are you okay to participate with me today?
Yes.
Okay, thank you. So first, we will inspect the external ear. So in this manner, we will inspect the angle of attachment. So we will draw an imaginary line just here. We will start with the right ear and the outer canthus to the helix. So here's the helix. So we will draw an imaginary line there and draw a perpendicular line just right here and measure it. So it is about 10 degrees. So it is normal. The angle of attachment is normal for the right ear. We will do it in the other side. The angle of attachment is about 10 degrees. So it is also normal for the left ear. And now we will inspect also for both ears the skin. So as you can see here, the right ear and the left ear of the patient is the same color. In the face of the patient or the client, it is the same color. And we will check if there is drainage in both ears. So we can use our pen light, the right ear, so there are no drainage. And we will palpate the ear for consistency and tenderness. So I will now be touching your ears, sir. So you will palpate here. Just say to me if sakit or nabay pain. Sakit. How about dire? Kani. Dire dapit. Dili. Dili ra.
Dili.
Okay. So the right ear is normal. Okay, we have the left ear. Dire.
Dili.
Okay. Honey. So mastoid process dapit.
Dili ra.
Your tragus. Anti-tragus, below. Here. Below. So yung helix. Wala ra. So normal. No pain and tenderness detected. So it is normal. So after palpating the ears here, we will also palpate the following structures prior to the otoscopic examination. So in this process, as I palpated also the parts of the ear, so we will start with the tragus. This is the tragus. Can you face the camera? So here is the tragus. This is the anti-tragus. So the tragus here, the helix, and the mastoid process. So, priha ganina, nabay sakit nga naramdaman nimo?
Wala.
Wala. Here.
Wala.
Here.
Wala ra.
Wala ra. So, the right ear is normal. So, the left ear, start here. Wala ra.
Wala ra.
Dire.
Wala.
Honey.
Wala.
Wala ra. So, it is normal. So, there are no tenderness or pain stated by the patient. So, here, it is all normal. So, we will start with the otoscopic examination. Now, in our otoscopic examination, since we don't have any otoscope, so we will have to examine it with the use of magnifying glass under pen light. So, we will perform first the tug test. Dili ra sakit.
Dili.
Dili ra sakit dire. Okay. So, it's normal. So, we will now proceed with the otoscopic examination. So, we will utilize the speculum, appropriate speculum for the client, but we have here ours, and instruct the client to tilt the head to the opposite side. So we will start first with the right side, and we will pull the helix appropriately. So in this case, since bata pa man, since he's a child, 11 years old, we will pull the helix back. So we will pull it down and back, and for adults, we will pull it up then back. So, and this will hold the otoscope with the pen, with the handle properly. So, we will raise the hand of the client's head, and we will insert only to the outer third of the canal. So, we will inspect the canal, the ear canal, and check if the tympanic membranes for its color, and perform the procedure on both ears. In this case, I will start with the right ear. Thank you, sir. Can you tilt your head? Okay. I will start it here. So for the right ear, we have no drainage, a little bit of cerumen, and hair. And for the tympanic membrane or the eardrum, the color is pinkish to pearl gray. So it is normal. So we will do the same here on the left ear. So I will move here. you. The same goes with the left ear. There is a little bit of cerumen and the hair. So, and the tympanic membrane is pinkish to pearly gray in color. So, it is normal. So, thank you. So, dili ra sakit,
Dili ra.
dili ra laylay.
Dili.
Also, yeah. So now that we are done with the otoscopic examination, I will now perform the hearing test. So first, I will perform the whisper voice test. So I said earlier that I will also assess your hearing acuity in this manner, sir. So first, I will do it for the right ear, and I will cover the opposite ear, rubbing his tragus, or you can cover it in your hands. So are you okay to cover it?
Yes.
Okay. But I can also cover it and have his tragus, so rub his tragus. So, and this we will stand behind. I will stand behind the patient 1 to 2 feet and have a syllable number or words for him to repeat to test his hearing acuity. So in this manner.
365.
Okay. So we're done with the right ear. We'll assess the left ear for his hearing acuity. So
184.
okay. So for the whisper voice test, it is normal. Now we will perform the ticking watch test. So instruct the patient to cover the opposite ear being tested. You can cover your ear here. So we will start with the right ear and holds the ticking watch. Then 5 inches away from the ear. So here. Madungogra.
Yes.
Okay. So the other side, the left ear na pod. How about this? Dungogra?
Oh.
Okay, madungogra. So normal for the ticking watch. So now that we are done with the ticking watch test, I will perform with the Weber test. So we have our tuning fork here. So in this manner, I will test if you have normal lateralization in hearing the sound. So tell me unya if either one ear or both ears ka makadungog sa sound, okay?
Yes.
Okay. Asa man mo madunggan?
Duha.
So it is normal. The client has normal lateralization in hearing with both ears. We'll now perform the Rene or the Rains test. We will also use our tuning fork and we will also note if he has hearing acuity, and in this manner we will also take note the air conduction and the bone conduction. It is important to note that the air conduction should be longer than the bone conduction. So we will start with tapping here, placing it in the mastoid process. Madungogra.
Dungra.
Okay, we will use our watch. Mahinay na.
Ah.
Okay. Dire madungogra.
Dungra.
Mahinay ra.
Hinay.
Okay. So we will perform it in both sides also. Dungogra.
Dungra.
Iingon o kanus anahunong. Hunong na. Okay. Dungogra.
Dumogra.
Nahunong na.
Ah,
Okay.
ano na.
So, we are done with the test. And lastly, we will perform the Romberg test. In this manner, we will have to instruct the client to stand up. Stand up. Yes. Stand with feet together, feet together. Okay. And eyes open and close. Close. Stand close to the patient. Okay. So, he has the normal ability of balance. So, now, lingkod na. So far, so good. And all the tests and the palpation and the examination of his ear assessment are normal. So, lastly, we will document it. Document the findings. So far, so good. Normal ra ang imuhang results, sir. I would also want to teach you na kanang atuli nato or serumen nato, dili na ingon nga kanunayon or kada buntag ka mag-clean because our serumen or the atuli is the lubricant, and also your hair can filter any debris or the bacteria, so it is also a key in maintaining your ears. So dili kanunay mag-atuli ha, mga tuli. So in this manner, we will not use cotton buds. Pwede og katong inane this for the ears. So here we have here, you can use it here kaneng right inane. You can scoop out your excess serumen or your atuli kay para ma-maintain ra. So thank you for today's assessment and participating with me, sir. Thank you so much. Thank you so much for participating today. So after this, I will remove my gloves and do hand washing technique. So properly dispose the gloves and the receptacle bin. And now we are done. That is all for today. Thank you and Godspeed.